Be working on you said the right side, Jimmy? Yep. Okay, so I'm just going to pull up the shirt, and then usually about T7 to T9 region for this technique. And then I'm going to be using my pisiform for the contact, and it's going to be right over the costotransverse. You can come in and gently palpate feel the stiffness, or you've done your prone exam already for identifying that said target area. For Jimmy here, I'm going to come up and over after he's already folded his arms nicely for me. And then I'm going to just, with the edge of my pisiform, I'm just going to kind of come down each rib to find the areas where I'm feeling a little bit maybe hypermobility, so it's a little bit higher for him. So I'd say that of the ones that we've pressed on is probably the stiffest. Okay, I'm going to start off by the technique by just having Jimmy nice and relax his head. Yep, and then so he's going to be slightly extended. I'm going to have myself in this fencer stance as I side bend and rotate away. And then that's just for the setup, making sure that he's nice and relaxed, his core is disengaged. Then I'm going to drop the opposite shoulder, and I'm going to come up and I'm going to thrust up towards the corner of the room, almost like I'm a shot putter. So I'm going to get my contact once more, and then we'll go through it. Jimmy, go ahead and scooch a little bit back towards the edge of the table. So the closer that he is to me, a little bit. Yeah, that's great. Yep. So we're going to drop, thrust, drop, thrust.